Today we're going to look at a scan of a patient that we recently made, and this would be, we're going to open the file, and oftentimes we'll go into Explorer, and we're going to right click on the bottom of this bar here, there we go, and go to, sometimes this is tricky, there we go, toolbars, hide all. Okay, so this patient was complaining about she's been experiencing some pain on the lower back teeth, and so it looks like a nice 10 by 10 scan here. We're going to go into the axial view and just grab this bar and slide. See, we're going up there, then we're going to slide down till we get to where we can see the roots of these teeth. And then we begin to see, you can see a radiolucency on the patient's right side and the patient's left side. So to get an idea, when you're looking at this axial view, it's as if the patient were sitting or laying in this position like this. So you've got the patient's right here and the patient's left here. Okay. So first we'll look at the patient's lower right. I'm going to hold the, let's see. Let's see. Okay. So when you hold the right button down, it's going to spin like that. I'm going to hold the left button down and slide this over. I got a little bit of lag being on remoted in here. I'm going to hold the right button and rotate the jaw. And then on the sagittal view, I'm going to hold the right button down on the mouse, rotate up, and hold the left button. And we're going to put the green line, which is the coronal slice, right in the middle here. And then we're good with the sagittal plane, and then we're going to just rotate so that our sagittal and coronal planes are making a bullseye in the axial view. So on this, it makes it straightforward to communicate to the patient. We have a large cavity in the tooth that you can see here in the sagittal plane, and then you can see in the furcation of the tooth where it's dark, we've got bone loss. We just explained to the patients that things that are less dense or the least dense, like air, are black, like here or here, and then in things that are the most dense are white, like the metal fillings in these upper teeth. So what I'll do is I'll show the patient, and what I communicated to the patient here, you can see that the nerve coming right along here, and when we look in the coronal plane, you can see that the damage to the bone from the tooth infection has invaded the space of the mental nerve. So, pardon me, the inferior alveolar nerve. So we've got right there, so I just explained to the patient, extracting this tooth, there is a risk for altered sensation of the chin, a lip and chin on that side, actually in this case on both sides. I just tell the patient we're going to be very gentle and careful around the bottom of this extraction socket, but it is a possibility, and the patient understood. Now on this side, you can see the infection it's probably made its way up and draining to the lingual here, and so this is the patient's right. And then now we're going to move over to the patient's left side, just holding the left button, dragging over, and now the right button to rotate. Now we're going to rotate in the coronal view, left button to drag it, left button to drag it over in the sagittal view. And the same thing here, we're just going to be putting the crosshairs right on the tooth. On the axial view, we're going to go straight mesial distal. Now on this view, you can see that the abscess or infection is taking away quite a bit of bone on the on the lingual side. And here where you can see that there's a break in the bone, or not a break, but a place where there's missing bone. This is where the patient actually had a draining fistula on the lingual side. So the infection was actually draining out under the tongue on the lingual side. So again, that's something that we communicate to the patient. You can see in the coronal view that the infection does make its way down to the nerve right here. The patient hasn't experienced any altered sensation yet, but just I made her aware that we are working very close to the nerve. And then we would show the patient, we've got the infection here, and this just makes it very clear to the patient. And if you're setting this up, you know, these are the views that would be most helpful to communicate to the patient. And the last thing I'll show you is if we rotate this, again, having a little bit of a lag here, but you can see the hole right here. Thank you very much.